So the Hypertrophic Cardiomyopathy Association is presenting a special webinar to provide interested patients a clear understanding of how to access a recently, April 2022, FDA-approved first-in-class medication for the treatment of symptomatic obstructive hypertrophic cardiomyopathy. The drug's name is Camzymes or Navigator. I need to say this for the purposes of this event. I, Lisa Salberg, founder and CEO, requested representatives from Bristol Myers Squibb to present this information in webinar format to help ensure patients and families a clear understanding of the approved label indication, risk evaluation and mitigation strategies, REMS, the role of the BMS Patient Navigator, patient assistance programs for various insurance subtypes, and a deeper look into Medicare Part D and how it works for those who may soon be transitioning to this type of insurance access. This session is not intended to determine patients' treatment, provide clinical comments about individual management, or suggest that the agent being discussed is superior to other therapies available for obstructive hypertrophic cardiomyopathy. And I want to be very clear that the funding to make this presentation possible came from the general operating budget of the HCMA. We have not received any compensation to provide this segment. We just feel that it's really important that patients have a really clear understanding of how to access the drug if they should want it. So with that being said, I am going to welcome the team from Bristol Myers Squibb who will each identify themselves as we go forward, and Gavin, who is here from the Alliance for Patient Access as well. So everybody say hi.
Hello.
There you go. It's not exactly those tough corporate events, right? You get to deal with me rather than other people. Okay. So, I'm going to go back to my screen share here for a second just to show everybody the agenda as it relates to the team from BMS and what we're going to be hearing today. And we're going to go one by one with these in a moment, but we're going to get a welcome introduction from Michelle Calopi, Vice President of U.S. Cardiovascular and Established Products for BMS. We're going to get an overview on Camzymes and REMS from Michael Palladino, Director of U.S. Medical for BMS. I'm just shortening Bristol Myers Squibb to BMS, or we'll be here all day. We're going to talk about the overview of insurance coverage methods with Tim McGovern, the Director of Access Marketing. And then we are going to look at the patient support programs. And we have two speakers here, and I hope I do not kill a name, Tracy Lukey and Nilofer Wasti. I might have
Nilofer Wasti. Yep.
Thank you for the correction. And then we'll do some Q&A. Then after they're done with their segment, we're going to talk about Medicare. So without further ado, I'm going to hand this to Michelle Calopi. And thank you all for your participation today.
Great. Thank you, Lisa, and good afternoon to all of you joining us today. And first and foremost, Lisa, let me say we're honored and thrilled that you requested to have us here. And we're really excited to share the information with you and with your patient community. So the next slide I have is actually the one Lisa covered, which is the agenda slide. And as you said, we've got a panel of experts, and we're really excited to share our information with all of you. So it's a packed agenda. So I'm going to move right into my first slide, which is the next slide, which is really, as Lisa said, earlier this year on April 28th, the FDA approved Camzymes for symptomatic obstructive HCM. And I can tell you, we are really thrilled that Camzymes achieved this approval, because Camzymes is known as a cardiac myosin inhibitor. And we'll talk a little bit more about that in Michael's section, but it's the first of its kind that has been approved. And it's really exciting for all of us, and hopefully for all of you as you get more information. And here at Bristol Myers Squibb, our mission is to discover, develop, and deliver innovative medicines that are going to transform patients' lives. And we know that Camzymes has the potential to help patients. So without further ado, I'm going to introduce my colleague, Michael Palladino, to take you through the overview of Camzymes. Michael?
Great. Thank you, Michelle. So again, my name is Michael Palladino.
and I'm a medical director on the US team for Camzymes or mavacamten. Completely excited to be here. I spent about 10 years in hospital practice as a pharmacist in Philadelphia before entering the pharmaceutical space. So it's been quite some time before I've had the opportunity to get in front of a number of patients. So this is a wonderful opportunity. So Lisa, thank you, and thank you to the HCMA. I have a number of slides here that are very content heavy, okay? But my goal is to really deliver a number of educational points. And if I do a good enough job, I think if you can come out of here understanding what Camzymes is and briefly understanding the REMS program and how we keep patients safe, then I've done my job. Here you see on this slide, Camzymes or mavacamten. As said before, Camzymes is prescribed as a prescription medicine used to treat adults with symptomatic, obstructive, hypertrophic cardiomyopathy or HCM, and may improve your symptoms and your ability to be active, or functional capacity as we call it. Next slide. So much of my presentation, I like to keep it very casual. There are moments when I cannot be casual. This will seem fairly robotic, but here is some safety information that I want to read through word for word to make sure we keep everyone very safe and we are very clear with the potential of adverse events with Camzymes or mavacamten. So Camzymes may cause serious side effects, including heart failure, a condition where the heart cannot pump with enough force. Heart failure is a serious condition that can lead to death. You must have echocardiograms before you take your first dose and during your treatment with Camzymes to help your healthcare provider understand how your heart is responding to Camzymes. People who develop a serious infection or irregular heartbeat have a greater risk of heart failure during treatment with Camzymes. Tell your healthcare provider or get medical help right away if you develop new or worsening shortness of breath, chest pain, fatigue, swelling in your legs, a racing sensation in your heart, also known as palpitations, or rapid weight gain. So I'll stop there 1 second. Take home messages. If you have any of these symptoms, swelling, chest pain, etc., call your healthcare provider immediately, okay? And this is not unusual, right? This is not just specific to Camzymes. This is if you feel these symptoms at all, you want to notify your healthcare provider. The risk of heart failure is also increased when Camzymes is taken with certain other medications. Tell your healthcare provider about the medicines you take, both prescribed and obtained over the counter before and during treatment with Camzymes. So these are known as drug-drug interactions. There is the potential for drug-drug interactions with Camzymes. And again, just like any other medicine, when you start, stop, increase dose, whether it's over the counter or a supplement, you need to talk to your pharmacist and the prescriber. Because of the serious risk of heart failure, Camzymes is only available through a restricted program called the Camzymes Risk Evaluation and Mitigation Strategy, also known as the REMS program. Your healthcare provider must be enrolled in the Camzymes REMS program in order for you to be prescribed Camzymes. Before you take Camzymes, you must enroll in the Camzymes REMS program. Talk to your healthcare provider about how to enroll in the Camzymes REMS program. You will be given information about the program when you are enrolled. Before you take Camzymes, your healthcare provider and pharmacist will make sure you understand how to take Camzymes safely, which will include returning for echocardiograms when advised by your healthcare provider. Camzymes can only be dispensed by a certified pharmacy that participates in the Camzymes REMS program. Your healthcare provider can give you information on how to find a certified pharmacy. You will not be able to get a Camzymes prescription at your local pharmacy. If you have any questions about Camzymes REMS program, ask your healthcare provider or go to www.camzymesrems.com or call the 1-800 number listed. Okay, I said a lot about REMS. So in short, as a patient, you must be enrolled. Your prescriber can help you with this. Your prescriber must be enrolled. And lastly, a specialty pharmacy must be enrolled, not just the pharmacy around the corner. Okay, so that was a mouthful. We got through important safety information. We will now go to the next slide. So what is obstructive hypertrophic cardiomyopathy. And many of you know this already, but the reason why this is important that we put this slide in there is if you truly remember and understand this, then you can understand how important how novel Camzyos is and how it helps treat symptomatic obstructive HCM. So we know that cardiomyopathy is a disease of the heart and a thickened heart muscle. So as that heart muscle thickens, particularly the left ventricle that you see in these cartoons, oxygenated blood cannot fill that ventricle the way it should. As such, oxygenated blood cannot leave that left ventricle the way it should. And as that muscle thickens, it can also often become obstructed. So now you do not have enough oxygenated blood getting to your brain, your lungs, tissues, and your organs. Then you get these resultant symptoms like shortness of breath. So the beginning starts at this thickening of the heart and this lack of oxygenated blood being pumped throughout the body, then resulting in symptoms. We know that HCM and obstructive HCM can be affecting up to 1 in 500 Americans at this time. And we also know, and one of the reasons why we're here today, is we want to bring awareness to this pathophysiology and to this disease. Next slide. So after understanding that, let's take a look at the mechanism of action of Camzymes.
Hypertrophic cardiomyopathy, also known as HCM, is a condition that affects the function of your heart. If you have HCM, it means that the walls of your heart have become thicker and stiffer than normal. In one type of HCM, called obstructive HCM, your heart muscle gets so thick that it blocks or reduces blood flow from the heart to the rest of your body, which can lead you to feel symptoms like shortness of breath, chest pain, dizziness, or others. Camzyos is the first and only FDA-approved cardiac myosin inhibitor. Camzyos targets the source of symptomatic obstructive HCM. Camzyos works differently by directly targeting a structure within your heart muscle called myosin. Let's take a closer look at the role of myosin in this disease. Myosin, along with another structure called actin, are proteins that are responsible for making your heart muscle contract and relax, which can contribute to your heart pumping. Imagine that myosin acts like people, and actin acts like a rope. When myosin attaches to actin, it's like a person pulling on a rope. When enough people pull on the rope, your heart muscle contracts. When enough people take a break from pulling, your heart muscle can relax. With obstructive HCM, too many people are pulling on the rope, which can make it difficult for your heart muscle to relax. This means your heart has to work harder and use more energy. Camzyos, also known as mavacamten, works directly with the myosin, helping more of them to let go of the actin or take a break from pulling on the rope. This allows your heart to relax, which may improve how your heart fills with blood, reduce how hard your heart has to work when it's pumping blood out to your body, and reduce how much energy your heart uses for each heartbeat. If you're interested in learning more, ask your cardiologist about Camzyos.
Great. So that's a wonderful video that is describing the unique mechanism of action of Camzyos or mavacamten. So now we talked about some safety information. We talked about mechanism of action of Camzyos. Now we dive a little bit deeper into the data or the science that brought Camzyos to prescribers and to patients. And what you see here is a depiction of the Explorer program, and that was the trial which granted mavacamten or Camzyos the FDA approval. So Camzyos improved symptoms and the ability to be active in the Explorer program. And so you'll hear me say a lot over the next few slides, feel and function. So when this trial was developed, this 251 patient trial, we were measuring endpoints around how the patient feels, so the symptoms, and the function, how that person and that heart is functioning off Camzymes therapy versus placebo. And the main efficacy outcome was looking at the New York Heart Association class for symptoms. So New York Heart Association class being class 1, asymptomatic, class 4 being extremely symptomatic. Patients enrolled in the Explorer program were class 2 or class 3. And patients could either receive Camzymes or placebo. But all patients had the opportunity to receive background therapy with beta blocker or calcium channel blocker. You see these little images on the left and the right. When we talked about function within these endpoints, we had patients on bicycles, and we measured how well they functioned under stress in the Camzymes arm and in the placebo arm. And what we saw for this primary outcome was people taking Camzymes achieved this primary endpoint compared to placebo 37% versus 17%. So roughly double the magnitude in the Camzymes arm versus placebo. So these patients saw significant improvement when it came to this feel and this function endpoint. Next slide. So when the steering committee and these experts developed this trial, they had that primary efficacy endpoint that we just described. They also have a number of secondary endpoints describing both feel and function. And one of the messages that really came through, and it comes through with experts that understand the disease state, is the obstruction or the LVOT obstruction, left ventricular outflow tract obstruction. Because after all, these patients had to be obstructed to enter the trial. And we measure this by echocardiogram. So when compared with placebo in this clinical study, Camzymes reduced the obstruction 4 times that of the placebo arm. So in essence, if somebody had an LVOT, this obstruction gradient of 80, in the Camzymes arm, they dropped nearly down to 30. There was roughly a 10 millimeters of mercury decrease in the placebo arm. So if that patient had an LVOT of 80, they dropped to roughly 70. So here we see a pretty profound difference in the way Camzymes impacts obstruction in the obstructive HCM population. Next slide. All right, so then we talked about that functional endpoint, that LVOT, that obstruction. Now let's dive a little bit more into symptoms and how the patient feels. Remember, I mentioned both function and feel. So when we looked at New York Heart class, remember, these patients had to be heart class 2 or 3. They were not 1 asymptomatic, nor were they class 4, the most symptomatic. What we saw was that 2 out of 3 people taking Camzymes had their symptoms improve. So that feel component continued to show a strong signal in the Camzymes arm versus placebo. Next slide, please. Again, some other feel or symptomatic endpoints. We mentioned New York Heart class, but we also measured symptoms with patient surveys. And this slide depicts 2 different surveys. On the left, you see this survey is called the KCCQ survey. And on the right, you see a shortness of breath HCM survey. And what we found for both of these symptomatic surveys, that there was a 3 times greater improvement in symptom burden and physical limitation when taking Camzymes versus placebo. So if I were to sum all of these efficacy endpoints up, again, the take-home messages for both feel and function, patients taking Camzymes has significant improvement versus the placebo arm. Next slide. I mentioned earlier a lot of important safety information around Camzymes, particularly the potential for heart failure. And on your left, you see that again. Anytime you have shortness of breath, chest pain, fatigue, racing heart, you need to notify your clinician. On the right, describe some common side effects with Camzyos, such as dizziness and fainting. Again, whenever experiencing dizziness or fainting, please contact your healthcare provider immediately. Next slide. Some more precautions. Again, in the important safety information, I mentioned drug-drug interactions. And on your left, this is a description of the conversation and the questions that your healthcare provider should be asking you. You really want to be aware and communicate when new medications are being added, doses are changed, if you start taking a supplement or over-the-counter medication. And on the left, you even see some sub-bullets of medications that interact with Camzyos, such as Prilosec or Nexium. These are heartburn medications that you can buy over the counter. There are alternatives, so please contact your healthcare provider if you take one of these medications. On the right, this is some important information that I do want to read and the conversation you should have with your provider. Camzyos may harm your unborn baby. Tell your healthcare provider right away if you become pregnant or think you may become pregnant during treatment with Camzyos. You may also report your pregnancy by calling BMS, reporting to the line below. If you are female and able to become pregnant, your healthcare provider will do a pregnancy test before you start treatment with Camzyos. You should use effective birth control contraception during treatment with Camzyos and for 4 months after the final dose of Camzyos. Camzyos may reduce how your hormonal birth control works. Talk to your healthcare provider for alternatives and about using alternative forms of birth control. Next slide, please. Some more important safety information. I will just touch on some highlights here. How should I take Camzyos? It is a once-a-day medication. You do not need to open this capsule or crush anything in the capsule. If you skip a dose, you take that dose as soon as possible. If you skip, for instance, a whole day, you just resume on the next day's dose. Next slide. Here is a highlight of the REMS program I mentioned earlier. And I think everything I mentioned earlier, the way that I distilled it down into the prescriber needs to be REMS certified. The patient, you have to have the conversation with your prescriber to get REMS certified, and the specialty pharmacy has to be REMS certified. Next slide. So I will stop there and hand it over to my colleague, Tim McGovern.
Hey, great. Thanks, Mike. And thank you for always providing a lot of very technical information in easily digestible form. So great job. And I appreciate that. So my job is to, after we've gotten through all of this clinical information and everyone's excited about this new first-in-class medication, to make sure that patients can get access. And when I speak about access, it means, will your insurance companies pay for it? So today I want to cover is kind of the overview of what the U.S. healthcare market looks like. So we can go to the next slide. So as you may or may not be familiar, that most of the insurance providers are either considered commercial insurance, Medicare, Medicaid, or some sort of other. And an other could be you get your benefits through the VA or if you're active military, you get it through TRICARE. So there are other kind of forms, but the majority are these three. And as we're talking about that, this is a first in class. The clinical community is excited, but I've spent a lot of time over the last couple of years trying to investigate how insurance providers are going to manage Camzyos. And there's a lot of education that needs to be done from an insurance perspective. They're very unfamiliar with this disease, and they're unfamiliar with Camzyos. They were paying a lot of attention to this disease. So now that we've got a branded specialty medication in the market, there's a lot of education that needs to happen. But the good news is that we've been doing it since last summer. So my teams have been out talking to your insurance companies and educating them on the disease, as well as what's to come for Camzyos. When it comes to Medicare, there are two different kinds of Medicare. So there are the standard Medicare Part D. This is an oral once-a-day drug. So we have Medicare Part D. This was a plan that was a program that was established back in 2006. But the out-of-pocket cost for those patients could vary widely as well. But we are limited BMS is limited in the ability that we can help those patients. But the best choice for those patients and all patients is really to start with Mycams. Once your physician has prescribed Camzyos, subscribing to or calling the Mycams call center or website. There's also the low income subsidy. And this is also called extra help, but this is a patient population. It's about 25% of the overall Medicare patient population. That just means that you were Medicaid eligible and you've aged out. Now you're Medicaid and Medicare eligible. The third section is around Medicaid. So there is rules in place around when Medicaid can cover it. They're all starting to approve, but the mandated time that they have to approve Camzyos is October 1st. So if they're not approving it now, they will have to by October 1st. The last one is around that other. So the military, they were the first to approve Camzyos. They were with a low copay for all active military, and now it's also Camzyos is now available on the in the VA. Now I know that we talked about that echocardiogram that was part of the REMS program that Mike had discussed. There's a lot of questions from physicians and from patients that will the echocardiograms be covered? Because the echoes are part of the Camzyos label, meaning that they're part of the REMS program, payers tell us that they will pay for them. So there's going to be a large number, there's going to be a number of echoes that need to happen. In the first few months, there's a few, and then it's going to continue on from that. But payers tell us, or managed care companies tell us, that they are going to pay for these echoes. So that is one of the biggest concerns we hear from your physicians. So be encouraged. So the last thing I wanted to touch on this slide is Mike had mentioned the specific specialty pharmacies that patients need to go to. Now the FDA is requiring us to have what's called a limited dispensing network. So we will have 4 national specialty pharmacies that you will be able to get your medication through, and all of those will be shipped to your house. There's no need to go to the CVS or local pharmacy around the corner. All of this will be done over the phone and through the mail. So you will be getting all of your Camzyos shipments through FedEx likely. So once you're prescribed Camzyos, get into the Mycams program so that we can do a benefits investigation. So I'm going to turn it over to Tracy Lukey, who leads our patient marketing team, and talk to you a little bit more about our program.
Thank you, Tim. I appreciate it. And I have to say, where you've spent the last year or so talking to insurance companies, I've gotten to talk to patients.
Yeah.
So I feel like I might have had a better deal there.
Yeah.
So my name is Tracy Lukey, and I'm the director for patient marketing. And I am going to talk to you a little bit more about what you've heard about the Mycams patient support program. And we can go ahead and advance probably 2 slides. There we go. So the Mycams patient support program was developed in partnership with HCM patients. Almost from day one, when we started working on this program, we started asking people who were living with obstructive hypertrophic cardiomyopathy what he or she may need when it comes to a patient support program. And we built it from the ground up with that patient voice loud in our ear. So we're really here with a program that's going to support you, answer questions throughout your treatment journey. Now, the program actually has 2 main components, and I'm going to talk about them separately, but I want you to understand that when you do, or if you choose to enroll in the Mycams patient support, both of these services will be available to you. One other thing I should note, while a lot of resources will be available, if you choose to go on therapy and have a prescription from your cardiologist, maybe you're at a stage where you just want to learn more for you. You want to talk to your cardiologist about the medication, ask some questions. It's okay for you to enroll in the patient support program now, just to learn more and have an informed dialogue. So we wanted to say that we've built this to talk to you regardless of where you are in your treatment journey and what your needs may be. So the 2 components to backtrack a little bit. First, my colleague Nilo, in a couple of minutes, I'll hand it over to her, is going to talk to you about the My Access Specialist program. The Access Specialist, as the name sounds, will be able to answer a lot of those financial or access aspects of the program that you might want to know about. So we'll talk about that. But now I'm going to spend a little time, and we can advance the slide, please. And I'll dig into the dedicated nurse navigator team known as My Nurse Navigators. Now, these are a team of nurses who have been hired to be just a resource to patients to understand more about Camzyos. And actually, once a patient has been prescribed Camzyos and has enrolled in the program, you'll be assigned your own dedicated nurse navigator who will guide you through the entirety of your experience with our program and on Camzyos. They will be there to answer questions you may have. So maybe you've gotten your prescription from your physician and you want to understand more. What was that drug to drug interaction my physician told me about? You can call up and talk to your nurse navigator, and they'll be fully prepared and are trained and actually out working with patients today to answer those questions about Camzyos. They'll also be there to help organize and keep track of key appointments. You heard about the need for echocardiograms, and the great news is, it sounds like from Tim, they'll be covered, but maybe just keeping it organized in your life. Your nurse navigators can set up with you appointment reminders, whether it's a text or a phone call or an email. So that's something that we had heard from patients they found would be valuable and is in market for you today. And there are other resources that will be available and that I'll talk to you in just a moment. But I wanted to reiterate one key point, which I think is important. The nurse navigators don't replace your cardiologist and your treatment team. So they're not there to advise on your medical condition. They're there to help you with Camzyos. So I wanted to make that very clear. But if we can advance the slide, this is some of the other resources I mentioned. So when you enroll in the Mycams program, we actually send you out your very own starter kit, which comes with a lot of what we hope to be valuable information and some tools to help keep you on track with your therapy. So you'll see the little graphic there with your calendar and some handy stickers so you can go in and keep track of appointments. We also will send you a full brochure that basically recaps almost anything you would have heard from all of us today. We provide a symptom tracker so that you can keep track of how you are feeling once you start therapy, so that you can have a good conversation when you go to check in with your doctor. And we also provide just a really comprehensive document of frequently asked questions. So we're hoping that for a patient who may be considering a Camzyos prescription or someone who's actually starting therapy, that we've got a program there to meet your needs. So with that, I'll hand it over to Nilo and she can tell you more about the My Access specialists.
Next slide. Thank you, Tracy. So I'll be talking to you about the My Access specialists. In addition to the nurse navigators, we wanted to provide our patients with people that are going to help them navigate, the complexities of healthcare and understanding all of the resources that are available to them to help them access Camzyos. So once you and your doctor enroll in the Mycams program, we have a team of patient access specialists. And what those specialists will do is they're going to work with you and your insurance company to really understand what your specific coverage for Camzyos looks like. And they're going to help you understand what your out-of-pocket costs are for Camzyos. And then based on that, learn about resources that may be available for you. And we have a number of resources that we can point you to if you're eligible. So the first one is a free trial offer, which helps you get started on treatment. And so you may be eligible to have your first month of Camzyos free of charge. We have other financial resources as well, which include a copay program, which my colleague Tim had touched upon, where commercially insured patients may pay as little as $10 per month for their Camzyos prescription. We also have assistance available to help with the number of echoes that are required by the REMS program for Camzyos. And so in this, commercially insured patients may be eligible for copay assistance for those echocardiograms. If anyone has any questions about the resources that are available and whether they may or may not be eligible for them, you can always call 855-CAMZYOS for more information. And you can also sign up for those resources on mycamzyos.com.